So I chose the title of the non-hallucinogenic compounds, and we will get into what does that mean, and is there a potential for those compounds that act the same way as classical psychedelics, but do not seem to have any of the psychedelic effects themselves. Is there a role for those compounds? And it's something that many companies actively are working on. It's also a topic that is dividing people and therapists a lot, as you can imagine. But we can discuss that further in the Q&A session later on. But honestly, I'm fairly agnostic to the question, so now at least you know what I'm thinking about it. So I'll try to make as clean and as scientific an approach for this. It is going to be a little basic science from time to time. I hope that's okay, compared to the previous speakers that were more focusing on the therapeutic implications of these compounds. Just like Wim, I also need to announce some conflict of interest. Then I like to show this slide as one of my introductory slides, because all too often you hear about people mixing up the different psychedelic-like with the classical psychedelics, and I think it's important to keep in mind the mode of action, and of course sometimes the psychedelic-like compounds can be used for the same therapeutic purposes, but in order to really understand the mode of action, I think it's important to separate what are we talking about, what kind of compounds. And in my talk, I will be focusing on the serotonergic, also called the classical psychedelics, of which we know different subtypes, the phenethylamines, tryptamines that can be divided into ergolines and into others like ergolin, the LSD compound, which is an artificially made compound compared to some of the naturally occurring psilocin and DMT. And what is common for those classic psychedelics is that they stimulate the brain's serotonin 2A receptors. This is an image where you can see the distribution of the human brain's serotonin 2A receptors. And we have also here done some work to actually be able to translate those positron emission tomography images into real quantitative measures. And the 5-HT2A receptor is quite abundant across the neocortex and also less so in the deeper cortical structures, but there is no 5-HT2A receptor in cerebellum. So I'll just start off by briefly discussing a few themes that have been pitched when it comes to the work of the mode of action of psychedelics. And let's just talk about the first one, because that's particularly relevant when it comes to the discussion about non-psychedelic 5-HT2A agonists. And this is that the psychedelics, they induce mystical type experiences that can facilitate interactions with therapists and enable patients to gain insights into their disorders, which is the foundation for getting better. So this is, of course, a very psychological approach, which does not really explain biochemically or otherwise what is going on. But this is, I think this is what people often see as the mode of action. And true enough, when we look at this mystical experience that often is associated with psychedelic sessions, then we use something called the Mystical Experience Questionnaire, also called MEQ. And this is a questionnaire that you can fill in after the experience is over, the session is done, and you can ask people to talk about different aspects. The MEQ total score builds on 4 subscales. One deals with the positive mood associated with the psychedelic experience. another one with the mysticality, and then there's the transcendence of time and space, and ineffability, that is the inability to explain what you just went through. And as you can see on the left side, we here made a so-called latent variable model where we took the MEQ from a number of psychedelic sessions with psilocybin done in healthy individuals. And we asked them also 1 month later, in what way has the psychedelic session changed your life, either in a positive or in a negative way? And it's very rare that people respond to some of the negative things. So we were focusing on the persisting positive drug effects. And what we could see here was that in many ways, the experience, the quality of the experience that people have had during the session was determining their long-term outcomes, meaning that it really matters what they qualitatively had experienced in the long term. And that, I guess, is somehow speaking into the theory that it has to do with the quality of the experience, how well you react to this in the long term. It's also been shown that if patients with depression have a high MEQ score after a psychedelic session, they are more likely to benefit and to recover from their depressive thoughts and symptoms. So it seems to be a good handle for us to look at the qualitative aspects of the experience. But again, any association is not necessarily the same as causal. It could be that those who have a specific brain composition or biochemistry, that they are more likely to perceive a session as positive and with high mysticality. So we can't really say for sure that there is a causal association here. And one thing that is intriguing is that a while ago we also undertook some sessions where people were put in the MR scanner environment. Now, for those of you who have ever been in an MR scanner, you will know it's not a super pleasant experience. It's very noisy, it's very tight. If you have just the faintest idea about claustrophobia, then being in an MR environment while tripping is not particularly nice. And when we looked at the people who were in the scanner room while they were tripping and compared it to other people who were in a much more nice environment, as you can see here at the right upper picture, with quiet music and with sitters around and somebody stroking your hand, etc., then it is definitely very different. And what we could see was that for people who were in the MR scanner room, the mystical experience was way less than those in the quiet and nice room. The same goes for all the subsets of the MEQ, also for another measure, which is called oceanic boundlessness, which taps into things like spiritual experiences and blissful state. So clearly there was a dependency on the setting. It's not that we didn't know that that was the case, but I think this is one of the first cases where we have really found that we could measure a profound difference. And moreover, it was not just the acute experience, as shown in the previous slide, that also impacted people's perception of in what way had the experience changed their long-term positive perception of this, and how had it changed their lives in a positive manner. Again, these were all healthy individuals, but nevertheless, it shows the impact of the psychedelic experience, environment, and the setting. So let's move on to another common theme about the mode of action of psychedelics, and this is that the psychedelics, they promote structural and functional neuroplasticity, particularly in the prefrontal cortex, and that enables pathological circuits that are controlling things such as mood and fear and reward to be repaired. And this goes in this direction that by stimulating the 5-HT2A receptors and possibly eliciting brain-derived neurotrophic factor, which is a growth factor that it leads to increased synaptic density. As you can see here, sprouting goes on. You have activation of immediate early genes. You stimulate the BDNF receptor TrkB, and that can then lead to new synapses being formed, and perhaps in the long run, old synapses that are not useful for the purpose of getting well, that those are pruned out. And many studies have now shown in animal experiments how psychedelics in one form or the other can promote neuroplasticity. Another common theme that was touched upon by the first speaker is, again, animal studies that have investigated the so-called learning critical period for social reward. And this builds on the observation that we're all aware of, that there seems to be a certain window where the brain can learn new things. For instance, if you learn new languages before the age of 10, you will be able to learn to speak that language as your mother tongue, even if you already have learned a couple of other languages. Now, what has been done in these very meticulously conducted animal studies is to look at how the window for a social preference score and learning a social reward, how that can be shifted by treating these mice with, for instance, with psilocybin or other psychedelics. And here you can see that the normal pattern that is followed by mice can be disrupted, and you can actually kind of open the possibility for learn new ways of looking at elite social reward. And what has also been shown with a range of atypical and classical psychedelics is that it seems that the duration of the experience matters for this critical opening, so that if you have very long acting compounds such as LSD, then the chances of having a longer window open is possible, and potentially that should enable you better to adapt the brain and to make it more neuroplastic. And then there is also another theory, which is that, well, it's nothing to do with the 5-HT2A receptor agonism, which is shared between these compounds, but it has to do with the brain-derived neurotrophic factor signaling. And here the idea is that some of the psychedelic compounds can stabilize the complex at the TrkB receptor, which will better enable the BDNF signaling. So that is a way of making it a positive allosteric modulator, if you like. And it's also been shown with other classical psychedelics. And again, the idea here is that you can then activate BDNF by boosting the brain's own BDNF pool, and in that way make plasticity and survival for healthy parts of the brain. So these are a number of different ways whereby one can think about the psychedelic effects. Now, how do we know if a given compound is psychedelic? Well, in the animal literature, what is often done is to look at a phenomenon called the head twitch response. It's usually looked for in mice. And I'm just going to show, for those of you who haven't seen it before, what does it look like. And here at the right, you can see a pig that has received a psychedelic compound. And you can see that the pig has this characteristic head twitch response. It's looping. It's not because it's continuing all the time, but this pig has been given a psychedelic compound, and it will start to have these characteristic head shakes. And at the left, you can see one of Alex Kwan's images, and here you can see the head twitch for this particular rodent at the left, but not at the right side. Okay, so let me just try to see how I can move on with this. All right, so here we go. And interestingly, this is a graph that is frequently shown, and it's taken as an evidence for how you can take the head twitch response to be a proxy for the potency of a given psychedelic compound. And what's done here is that this group did a phenomenal work in synthesizing a long range of serotonin 2A receptor agonists. And they showed by taking the logarithm of 1 over the potency of the head twitch response and comparing it to anecdotal reports on how much compound do you need to take in order to get a psychedelic experience in humans. And as you can see, it looks almost too good to be true. I mean, keep in mind, this is a logarithmic scale, so you can still have a large variation by a factor of 10 or so. And also, we know that the doses that can elicit psychedelic experiences can vary a lot from one person to the other. So I think I would be a little careful the moment you start to think a little bit more about this graph. A lot of things comes to mind. One of them being that when you look at the head twitch response in mice, you would typically inject it intraperitonially. That means you would have a very rapid increase, but also a potentially rapid metabolism. So how long time do you need to watch the animal for the head shakes? In the humans, it's typically taken perorally, which means that it takes much longer to peak. It also means that the doses that are administered to rodents is sometimes 1,000 times higher than those. So the plasma concentrations in the rodents will be way, way higher than in the humans. But still, I mean, this is something that kind of supports the idea. Now, what is not shown in this graph is that we know of a number of compounds that do not, they are 5-HT2A agonists, but they do not elicit the psychedelic experience. And it's a little divided. Most of the time, head twitch responses are also not seen. But again, those compounds do not seem to be included in this graph. So is there a way whereby one could start to think about how can we measure the target engagement of a given compound? And this one way to do that in vivo in humans is by using positron emission tomography, where you have traces that bind specifically to the serotonin 2A receptor. And at baseline, under normal conditions, here you have the 5-HT2A receptors. But then we have also serotonin, endogenous serotonin activating here. But we also have, in this case, a radiotracer called SEMP36, which is also binding with a great affinity to these 5-HT2A receptors. Now, if we introduce psilocybin, the metabolite psilocin will also bind to the 5-HT2A receptors, thereby making the binding of the radioactive ligand smaller. And that means that as you have increasing psilocybin concentrations, you will have a decline in the PET signal. And that will conform to a single-site binding model with equation which looks like this. And just to give you an idea about how such an occupancy study is done, first you do a baseline scan, and you can see that there's a lot of hot binding here. So many 5-HT2A receptors are present in this case. Then you administer a 5-HT2A receptor ligand, and then you do a block scan number 1. And you can see now you have a reduction in the binding. And you can then do a second administration with an even higher dose, and then you will have even less binding in the block scan too. And in this way, you can define, here shown with ketanserin, which is a 5-HT2A receptor antagonist, a nice association between the plasma concentration of the drug ketanserin and how by increasing the plasma concentrations you can start to block the 5-HT2A receptors. And from this plot you can then define the concentration in plasma, or the dose if you like, with which you can block about half of the receptors. And this is what we did here in this study. You can do the same thing with psychedelics, and one of our projects was also to determine psilocybin occupancy of 5-HT2A receptors in humans, and then to look at the association between the serotonin 2A receptor occupancy in the brain and the dose given and the plasma psilocin levels and the subjective intensity ratings. And we gave different doses to 8 different people, healthy controls. You can see how the plasma concentration varies quite a lot after peroral intake of psilocybin, and that those who got just a small dose of 3 milligrams, they didn't have very high concentrations, whereas those who got the 30 milligram, they had a very high peak and very high concentrations over time. So generally, the experience is gone in 5 hours or so. But some also have a shorter experience and a more rapidly increasing experience. And then when we look at the reported intensity, and this was done by asking people with regular intervals, so how strong is the experience now on a scale from 0 to 10? And then people would reply maybe 8 or 9 or 10, or depending on that. And you can see that there was also a nice association between plasma concentrations and the extent to which people felt that they had an psychedelic experience. Now, when we looked at the brain scans, we could identify a nice association between plasma psilocin concentration in the blood and the occupancy in the brain. And this conforms very nicely to a single site binding model. And remember that these different colors, they represent different people. So it's actually quite striking how we were able to make all these different people respond in a very unique way. What we could see here in the middle panel was also that as the occupancy of the brain started to increase and you had to be beyond 30% here, you would see there was an almost linear association between the brain occupancy of the 5-HT2A receptors and the intensity rating. So when you had about 65% of the receptors occupied, you would be having a profound psychedelic experience. You could make that without the brain scans, but you can see that that association is much more noisy because it's dependent on how people report, among other things. And here at the bottom left, you can see that the doses that were given in mg per kilogram did also conform to such an icing. So this means that we could show a direct association between subjective intensity, plasma concentrations and dose, and also the subjective experience and brain occupancy. Now, what we've done later is to repeat the same type of experience, but now doing it in pigs. Why use pigs? Well, pigs have brains that are very large. They are gyrated compared to the lissencephalic rat brains. Pigs are extremely smart. They're way smarter than dogs, and they can learn a lot. So it is a very nice model for the psychedelic compounds. And I just showed you before how a pig reacts. It also gets the head shakes as a measure of psychedelic influence. Whether it's having a psychedelic experience or not, we can't tell, of course, but we can see the head shakes clearly. And in this case, we looked at 3 different classical psychedelics, the DMT, the psilocybin, and LSD, and we could identify the mean plasma concentrations, whereby we had 50% of the brain 5-HT2A receptors occupied with these different compounds. And this is quite consistent with the data that we can see in humans. So again, quite representative for what's going on in humans. And the reason we wanted to define these IC50 values was in order to make sure that we could compare different compounds at similar 5-HT2A receptor occupancies. So clearly, if you want to compare a range of different compounds, you need to compare them at similar occupancies in the brain in order to look at the effects on the 5-HT2A. So having established that, then I think now it's time to talk a little bit about the non-psychedelic 5-HT2A receptor agonists, of which we know several. There is the compound lisuride that used to be used for an anti-Parkinson treatment. 2-bromo-LSD tabanantalog has also been heavily investigated. It has been shown that it has many of the same neuroplastic effects, although it seemingly is without any psychedelic experience in terms of head twitch response, at least. And there are also a couple of other compounds that were from, I think, the Shulgin library. And he and his wife quite consistently tested many of these compounds and reported that Ariadne was not very effective for psychedelic experiences, although it did have some impact. Now, again, we don't know, are there issues with blood-brain barrier permeability? Is it rapidly metabolized? Does it even reach the 5-HT2A receptors in the brain? And without an occupancy study, we cannot tell whether there is target engagement. So we have taken, so far, a couple of these. We've taken lisuride and TPT, and we have looked at, do these compounds cross the blood-brain barrier? Do they engage, and at what IC50 values? But before moving on to show you those data, I'm just going to spend a brief moment talking about biased 5-HT2A receptor agonism. Because clearly, if you have 5-HT2A receptor agonists, why would they not work in the pharmacologically similar way? And one way that this has been explained in the past is that if you look at here at the B, you have an antagonist, so there is absolutely no signaling. You are blocking the endogenous serotonin or the psychedelics that are administered, so nothing will happen. And we know that as a quite good proof of the 5-HT2A receptor actually being a main target for psychedelic experiences. You can totally block the psychedelic experience if you take an antagonist. You can also intervene with a psychedelic experience by giving antagonists and thereby shorten the length and duration of the experience. Now, for the agonist stimulation, you will have engagement of 2 different pathways, one which is referred to as the G protein, and the other one which is referred to as the beta-arrestin 2 pathway. And if you have G protein bias ligand that only stimulates the G protein pathway, you will have that G protein upregulation or signaling, but you will not have any beta-arrestin pathway. And vice versa if you have a beta-arrestin biased ligand. So the way that this has been explained is that the prototypical psychedelics activate both the GQ11 coupling and the beta-arrestin 2 transducers. And that it is through the G protein coupling that the psychedelic experience emerges. And this has been assessed by the head twitch response in mice. And also, if you give beta-arrestin biased 5-HT2A receptor agonists, so in spite of them being agonists in the way that they stimulate signaling, then they can block the psychedelic effects and induce some receptor downregulation and desensitization. So this has been followed up, and it has been also pursued by pharmaceutical industries as a means whereby you could potentially boost the neuroplastic effects, but without the psychedelic experience itself. So what we've also seen is this interesting association between the binding. The more 5-HT2A receptors you have, the less you seem to have of the MEQ, that is the psychedelic mysticality experience, which is so beneficial for long-term outcomes. And potentially this could be a matter of us looking at, with the Simply 36, we look at a mixture of those that are beta-arrestin and G-protein coupling. So if we have a change in the transduction, that could potentially be explained by this. We don't know, but it's a theory to be pursued. Now on to the occupancy plots. At the left, you can see TPG, one of the non-psychedelic compounds. And yes, it does engage with 5-HT2A receptors. It does conform to the single site binding model. So we know that if you give enough of the TPG, you should be able to see or to dismiss the idea that there is a headshake dependency. And same goes here for lisurite. Lisurite does indeed get into the brain, and it also binds with the expected single site binding model. Now, in this way, we can determine the dose at which we will have about 65% of occupancy, which is the magical limit for a profound psychedelic experience in humans. And by the way, I didn't show you the data, but we have confirmed that also in a recent study we completed with LSD. So both for psilocybin and for LSD, it's true that as soon as you get beyond the 65% of occupancy in the brain, you do have a significant psychedelic experience. So what we did on the basis of these PIC studies was then to take a dose of lisurite or of TPG that was corresponding to 65% of occupancy. And here you can see in this behavioral study where the pigs were awake and where we administered either saline, as you can see here with the gray. And of course, there is just a slight number of head shakes coming up, but that's just the baseline during the observation of 30 minutes. If you compare that to DMT, just need to put it in here. If you compare that to DMT, you can see that DMT is rapidly metabolized. So we have plenty of head shakes in the beginning, but after 20 minutes, it subsides, or 15 to 20 minutes subsides, and you have just baseline head shakes in those animals. If you look at psilocybin, you can see a pattern that is also emerging where you have more head shakes in the beginning, and then they start to go down, but they are more protracted than DMT. With LSD, the yellow one, you can see a delay, which is expected. We know that LSD takes some time to set in. It has a high affinity, so it takes longer for LSD to find into the pocket where it can stimulate. On the other hand, once it's sitting in the pocket, it stays there for quite an extended time period. And you can see correspondingly that it takes a little time for LSD to take off for the head shakes, but then it remains throughout the entire observation period of 30 minutes. Now, surprising what happens to lisurite here was that we saw, to our big surprise, we saw many more head shakes after a 65% brain occupancy dose than compared to any of the other psychedelic compounds. So this means that either the head twitch response is not really telling the whole story about psychedelic experiences, or potentially we need to look at the doses that have been given in different studies beforehand where this has been quoted to be a non-psychedelic compound. I haven't shown TPG here, but I can tell you that we also saw head shakes with TPG. And here you can see that if you administer doses that correspond to approximately the same occupancy level in the brain, you have quite similar number of head shakes with these three classical compounds, whereas with lisuride, we had many more head shakes in the majority of the pigs. So I think the story needs to be continued. We are actively looking into this. And the question of whether this has anything to do with biased agonism or not is to be answered later, I think, but because we don't know that yet. But it is important that when you compare different compounds, that you compare them at similar brain occupancy. So that's what I would argue. So just to summarize, and I think I'm doing fine on time now, is that that we now have emerging clinical evidence for therapeutic effects in several psychiatric and neurological conditions, as touched upon by previous speakers, that the full mode of action in humans is still unclear. But we know that the qualitative and the quantitative aspects of the experience are important for short and long-term effects. And that also includes the setting, as you can see here. I've shown you that in humans, the CYP5HT2A receptor occupancy is tightly associated with the subjective effects, the plasma drug, and the functional connectivity. I didn't show you data on functional connectivity, but that's also the case. And that we can see, based on experiments with psilocybin and LSD in humans, that if you reach about 65% brain occupancy at the 5-HT2A receptors, you will have a profound psychedelic experience, and that will linearly continue as the occupancy continues to increase. And I also showed you that the usefulness of using pigs in these studies, that we can determine brain occupancies, we can determine what doses to compare different psychedelic compounds at. We can investigate behavioral aspects such as head shakes in the pigs. And finally, that when we are comparing compounds at 65% occupancy, we can see that those head shakes in pigs show a time variant course consistent with known pharmacokinetics in humans. And with that, I would like to thank the group behind this, who did many of those experiments, and also the foundations that have supported the work we've been doing here. Thank you very much for your attention.
Thank you very much, Professor Knudsen, for this rather complicated subject. But let's see, do we have some questions? And let me start, or you have, okay.
Hello, thank you for your talk. So it seems that 5-HT2A occupancy doesn't give us the whole picture in terms of psychedelic experience or therapeutic beneficial of experience. What other players you would look into apart from track B? Are there any interesting crosstalks between different, in terms of receptor, binding to receptors? What would be those that you would stretch upon? Thanks.
Oh, let me stress that I think it is indispensable to have 5-HT2A stimulation in order to get the psychedelic experience. I think that generally, if there's something people can agree on, I think nobody is trying to argue that 5-HT2A receptors are not important. I think what you could say is that there could be additional routes whereby these compounds could work. Now, if we believe that we can completely separate the psychedelic experience from some of the beneficial effects we see in the brain, well, then it could be a potential epiphenomenon. And that, of course, would be interesting. And now here's, I guess, I'm trying to interpret your question. So what other factors could be in play? And I showed you a couple of basic neuroscience ideas that have been forwarded, such as, could it be that psychedelics are acting as positive allosteric modulators of the TrkB receptor where BDNF is acting. And I think that is an interesting theory. So we are currently working on, it's not something that's going to happen tomorrow, but I think it will be important to have access to that we're working on developing radiotracers whereby you can image the TrkB receptor in humans and potentially see how these are modulated once people are given psychedelics. So it could be some downstream effects that are going on. So I would say that yes, the 5-HT2 receptor agonism is for sure important for the psychedelic experience. It could be downstream effects of that signaling, but there could also be alternatives that have been mentioned here, such as the TrkB and the BDNF.
Let me ask one simple question. What is actually predicting the efficacy or you said this mystical or psychedelic experience? Why people have such a intra-individual variability?
Yeah, that's interesting. What we have looked at is also the course of the change in the psychedelic experience. So generally you have an upslope phase where people start to move into the experience, and so that has a certain slope, and then you have a plateau phase where they are having the experience, and then they gradually slide out of that. And what we've seen is that if you have a long plateau phase and a sharp onset, it seems that you score higher on MEQ and on the persisting effects. So there is also something about how people get into the experience and how long they are in the experience. This is not to say that long-acting compounds would necessarily work better than short-acting compounds. But we've also seen that the slope and the speed with which you get into the psychedelic experience and how long you stay in the psychedelic experience is also dependent on that person's 5-HT2A receptors. And this is actually something that is surprisingly different because, you know, for those of you sitting in the audience, you can maybe have a factor of 2 difference in your 5-HT2 receptors without knowing. We know that they go down with age, but still there is quite some inter-individual variability. So at least some of the inter-individual variability seems to be, can be ascribed to the variability in 5-HT2A receptors in the brain.
Thank you very much. And we have to move to the